Good morning. Excuse me, it's afternoon now, and welcome to our second webinar series for the Flint Community Webinar on Coronavirus. We're so thankful that you joined us today for this very, very important conversation that we're going to have. We trust that you, for those of you that are panelists, would please remember that we have asked you to be prepared to answer questions as they come up on the screen for those individuals who have already pre-registered. We thank those of you that have registered for today, and we want to let you know that today this webinar is being sponsored by the Healthy Flint Research Coordinating Center, which is a multi-institutional partnership comprised of community partners, academic partners from both Michigan State University, the University of Michigan Ann Arbor, and the University of Michigan Flint. We've worked hard to bring this to you together, and we are appreciative of all our community partners who have joined us today to give you very important information. Our goal with this is to bring a local context to this global pandemic. We hope that you will find this information very, very informative. We will have representation from our state, from the county health department, from our city representatives, and from several of the local organizations that have information relevant to what we should do here right in our community. So today, if you look at your screen, you'll see that we'll hear a perspective of the public health perspective on this virus, what the science tells us about from the medical and clinical community perspective. We'll also tell you a little bit more about how we can manage our wellness during this time, and then we'll introduce our partners. There will be open opportunity for dialogue, but in the meantime, we're going to ask you again, if you look at the bottom of your screen, you will see the Q&A button. Please click that button and input your questions. Our panelists from last week are back with us today, as well as new panelists. We will be careful to try to answer those questions as quickly as possible, and then we'll wrap up. We will be done at 1 o'clock today, so hopefully you will be very, very thankful that you joined us today. Let's begin this morning. You're going to hear presentation first from Dr. I didn't tell you, of course, I'm your moderator today. Thank you. Yvonne Lewis, I'm the co-director for the Healthy Flint Research Coordinating Center's Community Core and the director of outreach for the Genesee Health Plan. Dr. Deborah Holden is going to be our first presenter today. She is the Associate Dean for Public Health Integration and the director. She's also C.S. Mott Dowd Professor of Public Health, the Division of Public Health at Michigan State University College of Human Medicine. Dr. Susan Wolford will present to us as well on the clinical perspective. She's an associate professor of the Susan B. Meister Child Health Evaluation and Research Center. She's in the Department of Pediatrics. She's a faculty member in community engaged programs. She also is with Michigan Institute for Clinical and Health Research at which is called MISHAR, and a co-director of the Healthy Flint Research Coordinating Center. We'd also like to introduce to you Dr. Jennifer Johnson, who is a C.S. Mott Dowd Professor of Public Health. She is a professor of OBGYN, and she's also a professor of psychiatry and behavioral medicine here at the Division of Public Health, College of Human Medicine in Michigan. Let me remind you that I'm talking pretty quickly because I'm so excited about what you're going to hear. So I'm going to take a little breath and say, let me remind you, panelists, please look for those questions in the screen and answer them as we move forward. For those of you that will be listening to the presentations, please be sure that you ask questions based upon the presenters speaking. And now we will hear from Dr. Deborah Holden, who is also a co-director for Michigan State University for the Healthy Flint Research Coordinating Center. Dr.
Can you hear me? Can you hear me? I think we might have an echo. Everybody mute our wonderful moderator, please. About what the science is telling us from a public health perspective. All right, are we better? No more echo? No more echo? I claim this is what we get for trying to innovate and bring all this technology to bear in this season. So we appreciate you all and thanks for bearing with us. But this is what innovation looks like. So I want to just briefly touch on some of the public health points. I know people have heard a lot about what's happening in both the US and Michigan. So I just want to back up a few things with a little bit of the science and the data. In fact, if you have heard that the US now has the most number of confirmed cases, that is in fact true. This is something that I literally got hot off the press from the Hopkins Global Monitoring System that's happening. And if you see, the US now ranks #1 globally in the number of cases. What's really relevant for us, I think, is what does it look like in Michigan and where do we stand? And if you look at Michigan, we are now 5th ranked in the state for confirmed cases and deaths. And you probably also heard that we've got hot pockets. So these numbers are also clouded and it's important to consider that we've got hot pockets. We've had an outbreak in Detroit and in Wayne County, Macomb County, and several other counties. Dr. Wolford's going to talk a little bit about what that means and what some of those strategies are going to be for us to turn down the curve. So you've all heard about the public health strategies to slow down the spread. I just want to reinforce this notion of social distancing. And most importantly, this concept of don't be a vector. You know, many of us have had to make the adjustment of what it is to be working at home and in this period of what people are calling social isolation. But the real point is to limit the person-to-person contact and try to reduce the spread of disease. Also, again, regular hand washing, covering mouth and nose when coughing and sneezing, avoiding touching your face, and then cleaning high-touch surfaces often and regularly. We've talked a lot about flattening the curve. And again, want to just reinforce the flattening the curve refers to us using and implementing the protective measures that we know are critical to slow the rate of the virus so that our hospitals have room, supplies, and our doctors have the capacity to meet all the needs of the patients who need care. If we don't do that, what we end up with is a bolus of cases at a period where we're unprepared. If we can flatten the curve out, our goal is to ultimately make sure that our needs do not exceed the capacity of our healthcare system. Quick takeaways, 2 things that I think are important to note. 1, the social distancing is critical and it will help to slow the transmission. But what's really needed at this stage is widespread testing and contact tracing. Dr. Wolford's going to tell you a little bit more about the testing, and then you're going to hear clinically where we are and what's available in Flint.
Thank you so much, Dr. Verhelden. There we go. I'm just going to pull my slides up now and share those. And there we go. So as was mentioned, we're going to talk about testing, but I would like to just do a little bit of a brief recap of some of the things that we said last week, just in case we need a quick reminder. And so if we start off by thinking about what a virus is, we know now that a virus is a tiny particle that can't live outside of another host. It needs to be in a host. It's made up of this fatty layer on the outside that holds everything together, and then it has the genetic material in the middle. And I'd like to mention that that genetic material isn't the DNA that we are used to seeing when we think about genetics, but in coronavirus, that genetic material is a single strand of RNA, and that's going to be important in the testing as we think about that moving forward. So how does the virus work? We know that the virus gets into our body and into the cells, and it hijacks those cells and stops them from doing what they would normally do and makes them make more of itself. And in the case of the coronavirus, it does a very good job of hijacking the cells in the respiratory system. And that's why we see the symptoms that are typical of coronavirus. And if you'd like to know more about how this works, you can look at our webinar from last week. But now we want to think about how do you know if you've had it? So there are tests that can tell you about whether you're recovering from it. So if you've had the illness, you're recovering, you've made antibodies, you can get a blood test that will tell you whether you have antibodies to the novel coronavirus. But the best way to know currently if you have this novel coronavirus is by doing a test called a PCR that looks for DNA, nothing else. It only looks for DNA. And And you guys all know that test. It's the dreaded nasal swab. So you get that sample from the nose and as far back as you can go, and then transport it to the lab under very controlled circumstances with the right temperature. And in the lab, what happens there reminds me very much of cooking. If we think about it, it's like having a recipe to make sure we get the right result. And so imagine if you're trying to bake a cake, you might put in your eggs, you might add some milk, and then you could probably go ahead and add some flour. If you follow the recipe correctly, at the end of the day, you'll have a lovely cake. In this case, if you follow the recipe or the protocol for this coronavirus test, at the end of the day, we'll be able to tell whether the cells in your sample have the virus and whether that virus is in fact the novel coronavirus. So first of all, we add the first ingredient that extracts or gets that DNA away from all the other things that might be, or that RNA, sorry, that genetic material, away from everything else that might be in that sample. And then we add some more ingredients, and this transcribes it or makes it into the DNA that we need in order for the test to work. And then we add some more ingredients, and what this does is it amplifies, it makes lots and lots of copies, and then we add a dye. And if it is actually coronavirus there, it will make that DNA glow, it will fluoresce, and we know we have a positive test. So that's how it works. But there are problems sometimes. And so you, for example, could have the virus, and it could be in your sample, but say the test comes back and says there is no coronavirus, therefore it's a negative test. It would be a false negative test because we know you actually have it, but this test is saying that you don't. And that would be a problem. The reverse is also a problem. If you don't have virus in your body, you don't have any in the sample, but the test says actually you do. And so it says it's positive, but it's a false positive. It's false news, it's fake news, it's not correct. And so that was the problem with the original test the CDC made. It wasn't as accurate as it needed to be. And so they had to sort of start again, and that was the delay in getting the test out. But now we have a test where that recipe, that protocol is working correctly. And so we can start testing, and hopefully we'll get more and more people tested. As we, if we ask ourselves how many people are tested currently, well, if we think about the population of Michigan, there are close to 10 million people in Michigan. And if these blocks represent those 10 million people in Michigan, we've tested about just over 4,000 people, so 0.04%. That tiny sliver at the top of that box there is what's tested so far. So the vast majority of people don't know whether they have it or been in contact with it because they haven't actually been tested. And that's why we're really hoping to ramp up that testing now, because now that we don't know who has it, we all have to practice that social distancing that we spoke about. If you could be that one person who does not go out, who decides to stay at home, doesn't socialize outside of the home widely, stays at home, we can cut down on the spread and the transmission of this virus. And so we want everyone to really focus on helping to stop that spread. Because as we mentioned before, there are still no currently FDA-approved treatments. There are promising ideas, combinations of drugs, new antivirals, like Tamiflu, which I say doesn't work for this, but there are new ones on the horizon, getting the antibodies from people who have recovered, and therefore using those to help those who are sick, and creating new vaccines. There are no vaccines now that would work for this, and in fact, the vaccines that are out there for other things like yellow fever do not work for this. And it's important to note that these are just promising ideas, and we have to test it and know whether it actually works. Because, for example, one of the possible options, this combination of chloroquine and zithromax, when you combine them, it's important to do it in the right amount and test the risk, because there is a chance with this particular combination of a fatal arrhythmia that would cause, death. So one wants to be sure before you use it that we know the exact recipe that we've needed to make it work, if it will work in this case. So with that in mind, I then go back to what we have. We can offer fluids to help manage dehydration. We can give medications like Tylenol for pain and fever, and we can give oxygen for those who are experiencing severe respiratory problems. And that gets us back again into the issue of the resources within the hospital, the importance of flattening that curve so that we have enough of those resources as people need them. Do the social distancing, we can't say it enough. Wash our hands, avoid touching our faces if at all possible, and keep our immunity strong. And we'll speak more about that next week. So with that in mind, I'd like to hand over to Dr. Jennifer Johnson, who will be sharing with us next.
Good morning again. Just before Dr. Johnson starts, I want to remind our panelists, if you would please be available and go in and start looking at questions. And for those of you that are on the webinar, please add those questions. Thank you both, Dr. Deborah and Dr. Wolford, for that beautiful presentation. And it's just so amazing how those pictures make it clear for us. I want to also let you know that we are live streaming. So if you can reach out to other families and friends and community members who have not been able to join the webinar, they can pick this up through live streaming. We'll give you more details on that also as we go. So we're now happy to hear from Dr. Jennifer Johnson, who will speak to us about managing our wellness.
Fantastic, thank you. So, we'll review some of the self-care from last week and have some new, but the, basic self-care is worth remembering, especially when you're stressed. So just briefly, signs of stress in adults can look like fear or worry, anger, guilt, changes in sleep or eating, difficulty sleeping or concentrating, or increased use of alcohol, tobacco, and drugs. In children and teens, they're less good at putting words to their feelings. Sometimes it can look like crying, irritability, misbehavior that you haven't seen in a while, unexplained headaches or body pain, or returning to behaviors they've outgrown, like thumb sucking, bedwetting, etc. And ways to take care of yourself. These take care of you mentally, but they actually reduce your stress and will help you be more resilient physically. So, to the extent you can, exercise, walk outside, do a Zumba video on YouTube or something, do whatever you can to exercise and stretch a little bit every day. Reach out to your loved ones. That is just really important. Keep a schedule as much as you can. It may be different than the schedule you had before coronavirus, but stick to one. Take time to do things you enjoy. And, watch the news. I guess we're watching the news, but take breaks from it. You can't do it all the time. So if you need to turn off social media, turn off the news, read a book, go sit outside for a little while, do that. And then take care of your body. This is sleep, fruits, vegetables, minimizing substances. All of those things will help both your physical health and your mental health. For your children and teens, there was a question beforehand about what tools can we use to shield our children from mental problems that result when we're staying in place and the parents are working. This helps with creating a schedule and a routine for them with plenty of sleep, exercise, learning, and good food. It's not going to be their normal routine, but having a routine helps. Take time to talk to them, answer their questions directly. They may have heard things but may not fully understand the picture, and so it's important to answer questions they have. Reassure them that they're safe, that it's okay to feel upset. Don't let them be on news or social media 24/7. Help them connect by phone with friends and family, and be a role model for self-care. And another one of the questions we had ahead of time was, how can we calm people's fears? And one of the best ways to do that is through accurate information. So you can do that for your children and your teens and your family members, by sharing accurate information and then what they can do in ways they can take care of themselves, which are both self-care and the things Dr. Wolford said, social distance, wash your hands, etc. There were some questions about responders because, there are many responders in the community and they are working sometimes under very stressful conditions. And so it's important if you're part of the response, or even if you're social support for people around you who are sick or scared, recognize that responding to COVID can take an emotional toll on anyone. Secondary traumatic stress is real. And I think a lot of people who are responders are self-select into that because they like to think that they're always the helper and never the helpee. But this is just not the case. We can all get this. So secondary traumatic stress, they can be physical, fatigue or illness, mental, fear, withdrawal, guilt. Allow time for you and your family to recover from responding. On the time that you do have off, turn off the news, go home, be with your family, and make space for yourself. Make time for personal self-care activities that you enjoy. Again, this is just giving you a break, giving you an ability to breathe in the middle of a difficult circumstance. And, even supporters need support. And ask for help if you feel overwhelmed or concerned that COVID-19 is reducing your ability to care for your patients or your family relative to your normal. And I would say, the other question we had is for those already suffering from mental health issues, all of these things still apply. Stress makes us all more vulnerable to whatever we're vulnerable to, be it physical or mental. So take care of yourself, keep following your doctor's orders if you're on a medication, et cetera. A lot of the counselors have gone to telehealth, so call your doctor's office. If you have a mental health provider, call them, but just take care of yourself and understand that stress is just going to make whatever you have, you just need to take care of yourself that much more. And I'll hand it back to Yvonne Lewis.
Say it again.
Thank you, Dr. Johnson. We appreciate you so much because you gave us a wonderful segue when you spoke about accurate information. That's one of the reasons why we reached out to many of our local leaders in our organizations to be on with us today. And we want to thank them because they will bring a local context to this pandemic. So we're fortunate to have with us again Susan Cooper, who is the Public Health Division Director of the Genesee County Health Department. Susan, would you please bring us updates from the Genesee County Health Department? Susan? Okay, we will move forward then. She has not joined us yet, so let's move.
I'm here.
Hey.
Okay, we thought we saw you there, so thank you, Susan.
Innovation.
for joining us.
Hi, everyone. Hi. I just want to give you a quick update and remind you that we are posting our case counts to our website every day at 2 p.m. We are doing that consistent with what MDHHS is doing because the numbers are changing so quickly, we can't keep up with that. So again, our website is www.gchd.us. The numbers as of 2 p.m. yesterday were 63 cases that were presumptively positive or positive and 2 deaths. We will be posting again to our website at 2 p.m. today. I wanted to share with you that there has been a change in the priority guidance for who gets tested for COVID-19. And this is because there's a critical shortage of personal protective equipment. So the top priority right now are hospitalized patients, healthcare facility workers with symptoms. Priority 2 is patients in long-term care facilities with symptoms, patients over age 65 with symptoms, patients with underlying conditions with symptoms, and first responders with symptoms. The priority 3 list is critical infrastructure workers with symptoms, individuals who do not meet any of the above categories with symptoms, healthcare facility workers and first responders, and individuals with mild symptoms and community experiencing high numbers of COVID-19. There were questions asked about when there's going to be community testing. We have 2 hospital systems who are ready and willing to do so. The challenge has been the access to resources, the personal protective equipment that we've talked about before, the face masks, gowns and shields and gloves and goggles, all of those types of items are in critical shortage right now. That is part of the reason for this priority for tests. I wanted to direct you again to our website to let you know that we've posted a lot of great materials. All of our resources are directly connected with the CDC or MDHHS, or with our case counts entered, again, directly each day, so that we can give you the most up-to-date information, because everything is changing quickly. I want to remind you that we have a call center, so if you dial our mainline number, 810-257-3612, and press 9, you'll be able to speak to someone live and get some of your questions answered. And if we don't have an answer, hopefully we can direct you to someone who can answer your questions. We are actively participating with the Sheriff's Care Task Force, which is trying to coordinate all the efforts for our social supports for our community. There are food deliveries being made. There are a lot of concerns, and the task force is trying to address those needs, and all municipalities, including the city of Flint, are working very hard and trying to meet those needs. If you have any specific questions that you'd like to ask me, let me know. I will let you know that although our office buildings are closed at McCree South, there are still staff working on the phones addressing the concerns of our community, and our Burton Clinic is open by appointment only right now. So we do have immunizations, family planning, and STI testing happening by appointment. Our WIC staff are at home for the most part, working from home, answering phone calls and working in the MyWIC system remotely. But we do have some key staff people who are actually in the building at Burton. We know that this is a critical time, and as more people become unemployed, they're going to need WIC benefits. So they are specifically there to issue cards to new WIC recipients and to do formula exchanges. So we're trying to practice what we're sharing with all of you, appropriate social distancing, but we do want you to know that we are here and we are providing service to everyone as usual.
Thank you, Susan. So appreciative. Before you leave us, would you please give us that number one more time? And we want to remind all of you that this information will be made available.
This information has been posted to our website along with the 800 number for the state. So again, if you check out our website, www.gchd.us, you'll go to the COVID-19 page, and there are a great many materials there. For those who do not, please share with them. If they call the mainline number for the health department, 810-257-3612. There's an option to select number 9, and it will take you to our COVID-19 call center.
Thank you so much, Susan. We just want to make sure that our community members understand what those local numbers are, even as they reach out for the state numbers. We have on the line with us again, Dr. Lawrence Reynolds, who's the Chief Health Advisor of the City of Flint. Dr. Reynolds.
Well, good morning, friends and neighbors. The most important message is the Michigan MLive or the Flint Journal reported incorrect information. Water restorations, reconnections are continuing, and they will be ongoing. There is no discontinuation today. The number to call is 810-410-2020. We've contacted the Flint Journal to try to get them to correct that information. But once again, if your water is not connected, call 810-410-2020 to find out how you can proceed, because many people have slight variations and they need to talk to someone directly. As other governmental agencies, City Hall is closed, So using that number is most important. There was a report of brown water in a part of the city. I believe it was around the cultural center, and the water has cleared. We ask people to flush their lines, all their lines in their house, for at least 30 minutes to make sure that the water clears. Sometimes when there's not a complete break, but a sizable leak, but pressure remains, you may not get a notification to boil water, but you still need to flush your lines and run your filter. Sometimes chlorine may have to be added to sterilize the area. So if you're in one of those areas where there was a leak, where there was a repair, you may smell more chlorine than usual. As always, under any circumstances, we advise everybody to have 3 gallons of water for every occupant of the house, in the house, for 3 days. So that means a total of 9 gallons. So that in the event any of these things happen, you have water that you can use. Water restorations are continuing, and we need to get that word out. That's why I keep giving that number, 810-410-2020. There are city health navigators who will bring filters, and the device need to mount the filter to your faucet should you need that.
Thank you so much, Dr. Reynolds. This is why this is so extremely important. And we want to be sure that our community members that are on the line, we have a number of outreach workers that are listening. Please take this information. I know you're working from home, but you can certainly send this information when you're making your phone calls to your participants. We have now Dr. Renee Kennedy, who is the Chief Executive Officer of the Michigan Public Health Institute. Dr. Kennedy.
Thank you. Good afternoon, everyone. I'm really pleased to speak as a partner of our state health department. MPHI works very closely with the department. And I just want to remind or share a couple of points. One is that the purpose of public health is assuring the conditions necessary for good health. So when there's a threat to that, we activate in partnership with both our leadership, our workforce, and most importantly, our community. And so it's a little bit like Susan was saying in her remarks. We are endeavoring to remain in close relationship with communities to make sure we're addressing their concerns. When we say social distancing, we're not meaning relationship distancing. And, you know, we've adapted technology and a variety of strategies to stay connected to the needs. Our state health department, the Michigan Department of Health and Human Services, was very active in activating our Emergency Operations Center. And through that mechanism, which we refer to as our CHEC, the Community Health Emergency Coordinating Center, we do just that, try to coordinate all of the diverse needs. You can imagine that there are lots of responses in lots of communities. Public health is governmental and public health is local. Only what happens on the ground is going to have effect. So through that check, our Emergency Operations Center, we're working very aggressively to coordinate the needs of various partners. There are daily multiple calls with like local health officers coming together, with health systems coming together, with public safety. And so public health's role is really making sure communication is open, is accurate, and is efficient as we inform what the best response is for our community. Certainly the role of our Michigan Department of Health and Human Services and our Chief Medical Executive, Dr. Jonay Khaldun, has been to inform the governor and to be that immediate pipeline to her decision-making for the interest of the residents of Michigan. So I want to also refer you to another source. Now there's lots of information out there, right? So judge yourself and make sure you're not getting information overload, but I would encourage you to use some of the reliable sources that you are getting from this webinar, as opposed to a number of other sources out there that are, some of them are really quite questionable. So if you go to michigan.gov, you're going to see a big Corona banner, and you can click right on that. MDHHS has coordinated the information for residents and communities, for healthcare professionals, for childcare providers, as well as for employers and workers. There's also another hotline. Certainly take advantage of your local hotline that Susan has informed, but there's also a statewide COVID hotline, and that number is 888-535-6136. So 888-535-6136. So we are in the business of serving. That's the purpose of public health. Please continue to share your concerns so that we can respond efficiently to them.
Thank you, Dr. Kennedy. That is just so wonderful. And you've given us a great segue, because what happens at the state level and the county level also brings us to what's happening local. We have with us today Dr. Tupper, who is works in the emergency medical department at Hurley.
Okay, I'm done, Marcus. You can be noisy again.
For infectious diseases. And so we've asked them, because we want our community members to know what they should do and how they should respond in the event that they have.
I think they might have lost you for 1 second.
Dr. Tupper?
Yes.
There you are. Please share with us.
Yes. So thank you for allowing me to be on the call. So Susan did a very good job of describing some of the current limitations we have with regards to testing capability, and that we simply cannot test all individuals that may be concerned that they have coronavirus. So we are following guidance from the CDC, the Infectious Disease Society of America, MDHHS, our local infectious disease experts in the county health department, with regards to the triage and prioritization of testing. Ultimately, we are prioritizing testing to those patients that need admission to the hospitals, in addition to those at high risk for complications of disease, including adults that are elderly and have other significant comorbid conditions, as well as healthcare workers and other individuals that live in facilities such as nursing homes, where there is an epidemiological impact to perform testing. Keep in mind that when you come to the hospital, and even if you are tested for coronavirus, there is a lag with regards to the test result timing. And so currently we're looking at these being sent to the state of Michigan, but we're often looking at, as a best case scenario, a 48-hour turnaround with regards to receiving test results. We're working on improving that and getting that time frame down, but there are, in some cases, significant lags to test results. Ultimately, I can understand everyone's concerns, and this is a very anxiety-provoking time. And many people, anytime they have any type of symptoms, including myself, a scratchy throat, occasional cough, the instant thought that comes to mind is, could this be coronavirus? And I think one important thing to think about is if I were having these symptoms outside of this time frame, would I immediately be concerned? And so if we have mild symptoms that are concerning, okay to watch and see how those goes. Otherwise, certainly also reasonable to call your physician. Many healthcare providers are setting up lines of communication via phone line or telemedicine. in order to field and triage some of these calls. If you feel that you are severely ill and the symptoms that we are most concerned about is difficulty breathing, then by all means, that is a scenario where you may need to present to the emergency department. Previously, the guidance was to, if you were exposed to coronavirus, to call ahead. With community spread, we are basically at intake screening everyone that comes to the hospital as a possible coronavirus case. But if you know that you have been tested and have a test result that is positive or pending, please let us know at intake to the healthcare center. That is important information to know. I'm sorry, Deborah, I can't hear you. I think you are muted.
Deborah. Okay, thank you. Thank you, Dr. Tupper. You have given us a really important insight that we should definitely make sure if we have some concerns, particularly with breathing, we should make that known immediately. We also have with us today Clarence Pierce, who's the Chief Executive Officer of Hamilton Community Health Network, which is our federally qualified health center here. And he also has some important information about how we should access Hamilton Community Health Network. Clarence, please.
Good afternoon. It's a pleasure to be here with you this afternoon. And unfortunately, these times are not great, and we're doing everything we can to make things better for our patient population. First and foremost, we are making sure that we do everything we can to keep our patients and our staff safe in this uncertain situation. I'm happy to say that all of our clinics are open. And so if we have a patient who needs to get in, needs to see a provider, we are open for that. Now, we do an evaluation for those patients who do call. And what we try to do is triage the patient in such a way that we can screen out any COVID-19 if that happens to exist. So what we ask the patient is, do they have any of the symptoms that have been talked about here today, such as a cough, a fever, sore throat? Have you traveled in any of the outbreak areas, or been with someone for 3 minutes or less than that 6 feet social distancing we've talked about? Now, if the answer is no, then we can offer you telehealth, whereby we can call you and screen you and find out if we can actually provide you with the appropriate care by telephone, such as if you need a refill of a prescription, we can address that issue, and some of the other minor conditions that may come up, we can address that, or we can have you in clinic and can address that problem. However, if the answer is yes, then of course, the provider will have to evaluate you and determine whether or not there's a suspicion of COVID. And once that determination is done, then a decision is made about testing. And of course, we will then proceed accordingly with the test. I think what we try to do is make sure that any of our patients who may be compromised, who may be over the age of 65, we would like very much to try to deal with whatever problem they have by telephone and telehealth, and not have them come into the clinic. The reason is they may be susceptible to picking up something in the clinic, and consequently, we would prefer to address their problems by phone. So far, that has worked out pretty well for us. We're working with our other partners. At this point, we have the personal protective equipment that we need to work with our patients, and our staff is comfortable doing what they do. So again, we are open at all of our clinics. If anyone needs to contact us for a visit or just to determine whether or not something is going on with them, the number to call is area code 810-406-4246. That's 810-406-4246. And our operators are all manning their phone and will be able to help you and schedule you accordingly. Thank you.
Thank you, Clarence. That telepathy must have been working because we were certainly going to ask you for the phone number. So thank you again. I know you have questions, and we appreciate those of you that are sending in those questions, and we're doing our best to make sure those questions get answered. One of the questions we had from last week was about state of evictions, the executive order 2019 that the governor put out. There is a temporary prohibition against anyone on the premise for removing or excluding a tenant or a mobile home owner from their home. There is a website on the screen that you can
Thank you, Deborah.
or you can call 517-335-7858 if you need specific information. There are some unique scenarios that occur, so we want to encourage you to use this website and to call specifically if you have some detailed questions around the state of evictions order that was made by the governor. We want to move quickly because we have so much to tell you today. So again, please get those questions into us, and we're going to take a few minutes before we close to answer some of the broader questions that have been coming forth. But right now, we have our Community Foundation President, the Community Foundation of Greater Flint, President and CEO Isaiah Oliver, who has some really, really important information about resources that are available right now or soon. Isaiah.
Good afternoon, and thank you again. Thank you, Yvonne. Thank you, Deborah, Clarence, all of the doctors that are on the panel. I'm excited to be here with you all, one, to make an announcement, but also to provide maybe some detail about the Urgent Relief Fund. So many of you have probably heard or seen that we're raising money for the Greater Flint Urgent Relief Fund. That fund was established by a coalition of philanthropic, government, and business partners to quickly coordinate and deploy resources to nonprofits in the area that are working with communities disproportionately affected by the virus that we described today. This fund was established at the Community Foundation of Greater Flint in partnership with the United Way of Genesee County. The fund will award grants on a regular basis to nonprofits that are addressing the gaps that are surfacing in key areas for our most vulnerable community members. The Community Foundation and United Way are working to ensure that the fund has both maximum scope and impact. The fund partners encourage institutions, companies, and others to contribute to the fund. We are looking to work in three specific areas. The three priority areas are assisting with the immediate and anticipated direct service gaps that exist, maintaining or expanding internal operations or infrastructure for those critical nonprofits that are on the front lines doing work, and supporting the costs associated with additional volunteer capacity, because much like the water crisis, we are learning that folks are needing hands on deck to tackle the major issues that exist. The fund partners that I described below are folks who came in very early on as partners in this work. The Charles Stewart Mott Foundation made a grant of $500,000 at the end of last week to support the work. The City of Flint has been along for the ride. Community Foundation of Greater Flint is obviously a partner. The Flint Genesee Chamber of Commerce has been partnering with us while they're also looking to do some things around small businesses in the community. The Hagerman Foundation, Ruth Mott Foundation, and again, United Way as a major partner in this work. And we're hoping that inquiries can go to one place, the Relief Fund, or RELIEF Fund at cfgf.org. Now, we're hoping that everyone will direct both questions and inquiries about the fund to that space. But I think the most important thing that people want to know is, when is the information going to be available about grants? And right now, we're able to access grants on our website. The application is available. It's a much shorter application than you typically see from the Community Foundation. It's 3 pages all together. The first page is just information about the fund, and the last 2 are information about the project, ensuring that the project is being carried out by a nonprofit organization, that it's a charitable project, and that we have a small budget. That way we understand you have the capacity to do the work. If you hear loud noises in the back, it's because I'm at home with 4 amazing kids and learning how to work remotely. But the application is available on our website, loveflint.org. That's LOVEFLINT.org. loveflint.org. So loveflint.org, affectionately named for the folks who come together and support the work that's happening in this amazing town. I will say, although the name is loveflint.org, grants are awarded in a geographic area that covers all of Genesee County. So we are the Community Foundation of Greater Flint. So the geographic focus of grants is Genesee County. And we look forward to working with many of you on this work. I'll tell you, to date, we're running a tally of gifts in and grants out. We've made no grants, but we hope as we start to get applications in that we will be responsive within 7 to 10 days of every grant. And we'll be starting to make grants next week. We've established a committee that will be reviewing those grants on a 3 time a week basis, but 3 times a week. And we're hoping to start rolling out grants right away. $625,000 has been raised in total, again, including a $500,000 gift from the CSMI Foundation. We are continuing to do development while also planning to roll out some grants right away. So again, loveflint.org is the website that we want to direct you all to. We're looking forward to working with a number of people, understanding that $625,000 will move really fast with a pandemic this size. So we're also hopeful that you will encourage local nonprofits who have development arms to direct gifts here. That way we can focus those gifts in areas that have concentrated need. We're also hoping that you can ask for your local philanthropic organizations, philanthropy, your corporations and organizations to support this fund as well, because we'll be running through dollars as fast as we're getting them in. With that said, I think they gave me about 5 minutes and I'm probably about 3 in. I'll leave some time on the clock to answer questions, and I'm sure you probably have questions for many of the other panelists. So thank you again for having me.
Yes, thank you, Isaiah. We will definitely have questions for you, but so I want to remind our participants, please go to that Q&A button, push it and write your question in, because we have so limited time here today because our webinar will end at 1, but please understand we will answer your questions. It'll be up, so please keep the questions coming. We now have another wonderful group in our community, Greater Flint Health Coalition, who will be represented by Nicole Anderson-Smith, who is a special projects coordinator. Nicole, help us to understand what the Greater Flint Health Coalition is prepared to do in this season.
Yes, absolutely. Thank you guys so much. It's really nice to be here today. I'm here really because I wanted to let everyone know that our organization, we host a variety of different programs, and we have successfully transitioned all of those into remote style programs. So I just wanted to let everyone know that if you need assistance, for example, with healthcare coverage, or you want some information about nutrition and physical activity while you're stuck at home, or you want to learn more about our Flint Healthcare Opportunities program, we are open remotely. So I would certainly encourage you, you can do a couple different contact methods. One, we can visit our website at www.gfhc.org. You can give us a call. We're at 810-232-2228. And you can also visit our Facebook page. So Greater Flint Health Coalition Facebook page. You can get all sorts of information there. We just wanted to let folks know that we are available to assist you in any way that we can.
Thank you. I'm sorry, we're working on this technology. Thank you, Nicole. We do need a number from you for people to call to get insights from the Greater Flint Health Coalition. And then we have some really burning questions that we're going to ask of our panelists. So Nicole, please give us a number.
It is 810-232-2228.
Thank you so much. And that will be included in our information, but I surely thought people would want to know what that is. Now we have 3 big questions that we are going to pose to our panelists. The first one will go to let's talk to Dr. Tupper. Dr. Tupper, you mentioned what's going on at the hospital. One of the big questions I think everybody wants to understand is what's the capacity right now of our hospitals?
Yeah, so right now, all 3 hospitals in Genesee County currently have capacity. We have not yet seen, we are seeing patients that have tested positive or have clinical presentations that are strongly suspicious for coronavirus. But all 3 hospitals right now currently have capacity. Every hospital is coming up with internal plans for short-term and anticipated surge in number of patients. So, but right now, all three hospitals do indeed currently have capacity, and everyone, really every hospital in the United States is making contingency plans on how to deal with an increase in demand of critically ill patients.
Thank you, Dr. Tupper. And we just want to again acknowledge that there's so much that we can't answer today. So we want you to stay tuned. Please look at the future webinar opportunities and join us again. Harmony Lloyd, which was on with us last week from MTA, we would like to get an update from MTA because they're a major critical essential service in our community. Harmony, what's the update from MTA? Harmony, are you there? Okay. So we're gonna have to make sure we get her unmuted so she can share. I know she's on the line, but let me go again quickly then to Susan. Susan from the Health Department, there is a request for updated stats. Give us that information about the Michigan stats and the local stats.
Can you hear me?
Yeah. Yes.
Okay, so I'm not, this is the other Susan.
Okay.
I will say that the stats in the state of Michigan are updated at 2 o'clock every day. So the numbers are changing quickly. And so by 2 o'clock yesterday, the tests have gone up from 4,000, a little over 4,000 to almost 1,200. And I mean, sorry, they've gone up to almost 12,000. They've gone up from just over 4,000 to just almost 12,000. And who knows what it will be when those numbers come out today. But just to say that if you want updated numbers, it's changing quickly, and going to the state site, you'll be able to find that information.
Thank you. Harmony, are you able to speak now? Did we get you unmuted?
I'm here. Can you hear me?
Yes, we can.
Okay, great. I'll move really fast. I just want to let you know it's been quite a week for public transportation, so I'll go through the changes. We are not completely shut down despite some of the reports that have been incorrectly put out. However, we have made some changes effective this coming Monday. The city buses, or what we call the fixed route buses, are moving to an hourly schedule. So they'll run once per hour from 6:30 in the morning until 11:30 p.m. So they'll start at the downtown transfer center at the bottom of each hour, and then they'll do the route and be back at the bottom of the next hour. They are still fare free, and we're asking that people enter through the rear of the bus. Our Your Ride service is open and operating. We are asking people if they don't need it as an essential service, so to go to grocery stores or to go to medical appointments, to please not use it at this time. But if you need it, it is available. We're doing one passenger per Your Ride vehicle. Also having passengers enter through the rear of the Your Ride vehicle, and drivers have sanitizer, masks, and they're using them throughout the day to keep their vehicle clean. And then finally, our Rides to Wellness service, which is our medical transportation service, has been shut down as of yesterday until at least Monday, April 13th. We unfortunately did have one driver who has tested positive for the coronavirus, and we have two drivers who have exhibited symptoms, and their tests are pending. So we have completely shut down operations on Rides to Wellness. We've already had a professional cleaning company come in to sanitize all the buildings and vehicles. And we've asked the staff of Rides to Wellness to self-quarantine for the next 14 days. So we'll continue to evaluate what happens with those drivers and what happens in the community, and then we'll make a decision on Rides to Wellness. But if you do have clients or you know of people that need to get to critical appointments like dialysis or chemotherapy, we'd ask you to use the Your Ride system.
Thank you.
That's all I have.
I am so sorry, but our time is just about up for today. I hope that you found this informative. We had one major question about water, but we're going to ask Dr. Reynolds to be up and available. He's going to be online answering those questions for you right on the line. This is critical. Our community needs to know this information. So for those of you that are on, please make sure you take note of this. You can watch our video from today. It is going to be posted, and you go to the HFRCC website as you see on your screen. Our next webinar is next Friday. Please join us. We'll have additional information to share with you. We want you to know it's important we all be safe, and we want you again to join us next Friday at the same time. Thank you for tuning in, and we'll look forward to hearing from you and seeing you next week.